Merger will impact jobs, healthcare costs, and where you choose to get your care.
And today, for the first time, we have some more specific answers to your questions about those very issues. For one, thanks to Nate Morbido's question, we now know exactly how many jobs Ballad Health could eliminate. He continues our team coverage.
We learned today the estimate is 250 jobs in the short term, many of them administrative. These are jobs that are considered repetitive and could lead to a more efficient operation. Long term, the hope is to invest those savings and create significantly more jobs. Executives have said most of the savings will come gradually by not filling positions as people quit or retire, but until today wouldn't provide a specific number. Here's a clip from one of our interviews early last year.
Are you saying that there will be less than 600 to 1,000 job losses?
Oh, for sure. Yeah.
In the hundreds, maybe?
I'm not going to guess. I can tell you it would be far less than what if we were to merge with an outside system.
Now today, Josh, they told us that 250 number is nothing compared to the 1,000 jobs the systems could have faced and lost had an outside organization come into our region and bought both Mountain States and Wellmont. Another important promise in this COPA agreement, Ballad Health has agreed it won't fire any employees without cause at its 13 rural hospitals for the first 2 years of this merger.
Nate, you asked them about insurance today. In the past, the health systems have not always accepted all insurance carriers. Maybe you've lived with that as an issue, limiting where people can get care. What about post-merger?
All right, so in this agreement, executives say there is language in the COPA that requires Ballad Health to negotiate in good faith with every insurance payer, and incentives are in this agreement as well for both the health system and insurance companies to come to agreement so people can really pick wherever they want to get their care with no financial penalty, because that's what happens when you don't have access through insurance to a certain organization and network, of course. Ballad Health has promised to help more of the uninsured population as well.
Our intention is not only to serve everybody that's covered by any payer, but there's also provisions. Currently, our current commitment for charity care, we actually have increased our commitment on charity care.
This, of course, all under active supervision by the state. And in the event Ballad Health and insurance companies cannot come to an agreement, cannot agree on a contract, there is a process in place to mediate the situation.
A big theme in all this has been reducing the cost of health care. That's remained a huge promise from both health systems from the beginning, and they talked about that today, didn't they?
Yeah, that's right. And despite concerns by some insurance companies, the insurance industry, and the Federal Trade Commission, we have heard the same talking point time after time.
If this merger doesn't happen, pricing actually goes up more than if it does happen.
All right, so as part of the COPA agreement, there is a cap on how much prices can go up, and that cap is well below the national average. Today we learned specifics. Alan Levine told us the price growth cap is 33% lower than the national average.
One thing we didn't hear a lot of specifics about was how they were going to reduce redundancies in the system, that duplication of services. Over the last 2.5 years, that's been a topic. Did they talk about whether hospitals would close? What did you hear there?
All right, so Levine said hospitals are not going to close. That's something he made clear on the very day they announced this merger back in 2015.
No plans to close any hospitals, and I want to be definitive about that. Every one of these hospitals are important points of access for our system.
So, Josh, today he reaffirmed that stance and added if Ballad Health chooses to repurpose facilities like in Greene County or Wise County to be specific, the state would have to approve the new use of the facility. Levine said a repurposed hospital could mean certain services are consolidated into one hospital, while in the other facility it's converted to a use that's currently not available in our region, like services like psychiatric, rehab, and long-term care.
All right, Nate, thanks so much for helping break down all the many details here. Well, hospital executives also told us that they have their eye on possibly using the state-owned former Green Valley Developmental Center site in Greene County as a possible location. They kept using the word possible for a residential addiction treatment campus. As we told you last week, lawmakers are pushing to make Green Valley a federal Veterans Services site.